Hello, I'm Judith Anderson, an Associate Professor of Physical Therapy. As a physical therapist, I have treated many patients with arthritis. This presentation covers some of the concepts about arthritis and about the care of patients with arthritis. Arthritis means inflammation of the joints. There are many kinds of arthritis, but the two most common kinds are osteoarthritis and rheumatoid arthritis. Osteoarthritis, the most common form, is degeneration or deterioration of the joint cartilage. It is usually localized in a few specific joints, and it is caused by trauma to the joint and is associated with aging. Rheumatoid arthritis is very common also. It is a systemic disease affecting many joints at the same time. It is inflammation of the joint lining. Anyone can get arthritis. It can occur at any age. It can strike athletes or sedentary people. It can be severe or mild in its symptoms. It may flare up and then calm down, or it may follow a steady course. Certain conditions affect arthritis. Overuse of joints and muscles makes it worse, while rest makes it better. Exercise relieves pain and pressure on arthritic joints. A patient may have symptoms at different times during the day. Patients with osteoarthritis feel better in the morning and worse at night, while patients with rheumatoid arthritis tend to feel worse in the morning. Humidity and cold weather may cause pain and swelling in joints. Although arthritis cannot be cured, it can be managed. Management varies with the kind of arthritis and with each individual's symptoms. But there is an overall pattern of treatment and management of the symptoms. The general goals of arthritis treatment are 1. Reducing pain and inflammation of joints. 2. Increasing joint function and muscle strength. And 3. Preventing bone and cartilage destruction. The patient must take responsibility for managing his condition. There are 5 components to management of arthritis. First is regular communication with a doctor. Second, learning about arthritis. Third, rest. Fourth, diet. And fifth, regular exercise. The first requirement for the management of arthritis is that there must be regular physician-patient communication. The patient needs to find a physician who is knowledgeable about arthritis and to follow the advice carefully and completely. He must take medication on a regular schedule to keep the blood level steady, and he must set goals with the doctor. The patient needs to be aggressive about his health and see the doctor as soon as the condition changes. If there is pain, anti-inflammatory agents which control swelling and fever, or analgesic agents which control pain, are prescribed. Physical and occupational therapy is used to increase function and activity, and surgical intervention is sometimes used for joint release and joint replacement. Second, in the management of the disease, the patient should learn all he can about his condition. Managing arthritis requires understanding the disease itself and the symptom changes that occur over time. As the condition flares up, the patient must reduce his level of activity and protect his joints from stress. As the condition improves, the patient must increase the use of joints and increase the activity level too. There are many resources available for the arthritis patient. The Arthritis Foundation provides a wide variety of educational resources. Third, rest is essential for healing and decreasing inflammation. There are 3 ways that the arthritic patient can rest his body. First, pacing. This means that the patient should alternate periods of activity with periods of rest throughout the day. Second, total body rest. This includes good sleep at night and naps during the day. And third, resting inflamed joints. Inflamed joints need to be protected against overstretch and overuse. This is given by splints or by special positioning of the painful joints during sleep and rest. The patient needs to control his diet too. Good nutrition is necessary for repair of diseased tissue and for general good health. Please refer to your nutrition lecture for the specific rules about good nutrition. Weight control is also important because any unnecessary weight adds to the stress and pain of joints. The fifth factor, regular activity, is an important component of arthritis management. The patient needs to exercise every day. The exercise appropriate for people with arthritis is the same as exercise for everyone. But it must be modified to fit specific situations so that the patient will not be fatigued or overuse the muscles and joints. Exercise should include walking every day to increase exercise tolerance and keeping in good general condition by doing stretching and strengthening exercises. It is important to prevent complications of arthritis by maintaining and increasing joint range of motion. Motion must be maintained or it will be lost. Please refer to your range of motion lecture to see about this kind of exercise. It is essential for the patient to know how much is enough exercise and how much is too much. The symptoms of overexertion are pain in the joint and muscle, fatigue, and change of personality. The only symptom of a person becoming over-fatigued may be a change to irritable and cranky behavior. Overexertion is common when a patient has bursts of activity, such as weekend athletics when the rest of the week the patient is quiet, or when doing heavy chores for a long time without rest. Involvement in social activities such as community activities, church, and visits with friends is another form of regular activity. Your role as a healthcare worker in the care of patients with arthritis includes following care plan, assist with activities of daily living as needed,